Hi, my name is Prithvi, and today me and Sonam are presenting our topic, that is dietary approaches and chronic kidney disease. The class is clinical nutrition. The contents are introduction of chronic kidney disease, various dietary approaches and dietary approaches to stop hypertension, and Mediterranean diet. DASH diet and Mediterranean diet to safeguard the kidney, benefits for renal health, relationship between nephron loss and protein intake, and references. So let's start with the basics. CKD or chronic kidney disease is a major public health concern. The ability of kidneys to filter blood is hindered by chronic renal disease. As a result, the body retains more fluid and blood waste, which might result in range of diseases like heart disease and stroke and anemia, which is decline in blood cell count and increase in infection, appetite loss, and a deterioration in quality of life, and others additional health consequences of CKD. The risk of developing CKD is higher in those with diabetes and high blood pressure aside from old age. Kidney impairment from past heart disease, obesity, a family of history of CKD, genetic renal disorder, and obesity are the risk factors as well. Smoking, drinking, and sedentary behavior all contribute to lifestyle that supports CKD. Due to its negative effect on blood pressure and vascular health, a high salt diet is known as a risk factor for deterioration in CKD. So now let's talk about various dietary approaches. Dietary approaches to stop the hypertension, DASH and Mediterranean diet. The consumption of foods that correspond to typical dietary intake is referred to as diet, and based on it, it can be categorized as healthy or unhealthy dietary pattern. The Mediterranean diet, the dietary approach to stop hypertension, vegetarian diet, and any dietary intake strategy that focuses on overall pattern of eating rather than strategies of targeting specific nutrient are few examples of good dietary pattern. High intakes of whole grain, fruits, vegetables, and healthy fats, along with resulting fiber, vitamin C, vitamin E, and carotenoids intake, all are components of healthy dietary pattern. Along with these, low intake of processed foods and salt, saturated fats, and low dietary acid load are also component of healthy diet. In contrast, examples of unhealthy eating habits include Western diet and high-fat diet, meat-based diet, which are low in whole grains, fruits, vegetables, omega-3 fatty acids, fiber, and rich in refined starch and trans fatty acids. Dietary approaches to stop hypertension. The National Kidney Foundation has endorsed the DASH diet, which is recognized intervention for hypertension, heart disease, and kidney disease. Can delay course of heart and kidney disease. The DASH diet also includes plenty of fruit, vegetables, low fat dairy products, poultry, beans, seeds, and nuts. It has minimal level effect on fat, red meat, added sweeteners, salt, and sodium. The Mediterranean diet has a lot of fruit, vegetables, whole grains, and plant-based proteins. Along with this diet is also limits red meat and sweets while consuming fish, shellfish, dairy products, and eggs in low to moderate amount, which can help decrease the blood pressure. According to the study conducted, DASH diet and the risk of subsequent kidney disease it is found that risk of renal disease increased by 16% for people with lowest DASH diet scores compared to those with highest scores. High consumption of red meat and processed meat was linked to increased risk of kidney disease, but other protein-rich foods, including nuts, legumes, and low-fat dairy products, were linked to decreased risk of kidney disease. According to study, dietary patterns and renal health outcomes in general population, the Mediterranean diet's omega-3 fatty acid content, which is high in fish, nuts, and olive oil, may benefit kidney function due to monosaturated fatty acids to saturated fatty acid ratio, which has been linked to better plasma lipid protein, insulin resistance, and lower blood pressure. DASH diet is designed for fighting blood pressure, decreased risk of heart disease. The diet is effective treatment for kidney disease as it slows down the kidney disease. rich in potassium and calcium and containing moderate amount of sodium. The DASH diet is optimal for your kidneys. People who consume a lot of nuts and legumes will reported to have lower risk of developing CKD. The DASH diet has very low dietary acid load than typical diet, which is linked with the reduced risk of kidney disease. Mediterranean diet lowers the inflammation and nourishes the gut. Both are critical for kidney success. The number one cause of death in chronic kidney disease is not kidney, but cardiovascular disease is the leading cause of death for people with kidney disease. Mediterranean diets such as fruits, vegetables, whole grains, nuts, and beans are rich source of potassium. Plant-based diets are the sources of phosphorus are not fully absorbed by the body because it is attached to fiber. Studies show that only 40 to 60% of phosphorus from plant foods is fully absorbed, compared to dairy and meat sources which are upwardly 60 to 80% absorbed. They also provide fiber and are directly linked to improved cardiovascular health. Now let's talk about some relationship between nephron loss and protein intake. A high amount of protein intake leads to nephron loss via hemodynamic glomerular capillary injury. The renal blood flow is limited to animal protein intake, and a person following a vegetarian diet typically have low GFR compared to a person consuming animal protein. High intake of animal protein increases the loss of kidney function, so it is important to know how kidney protects itself from hemodynamic injury. The nephron protects itself from hemodynamic injury by vasoconstricting the efferent arteriole. Dietary sources of choline, phosphatidylcholine, and L-carnitine include red meat, cheese, egg yolk. Choline, phosphatidylcholine, and L-carnitine are metabolized in the gut, leading to production of trimethylamine N oxide and precrescyl sulfate. These uremic toxins are excreted by the kidney and should reduce kidney function. Circulating level may increase the risk of CKD and chronic kidney disease. These are some references. I thank you for your kind attention.